Hello there everyone, my name is Jackie and this is Melanie, and we're here today to discuss the advantages and the uses of the interdental tip.
The interdental tip is a self-care oral hygiene device that typically has a metal or plastic handle with a conical or pyramidal rubber or plastic tip attached to it. Before prescribing the use of this oral hygiene aid to patients, it is important to understand that it is not indicated for the use in all patients.
Patients that will demonstrate the best results with this oral hygiene aid are those who display symptoms of developing periodontal disease and gingivitis, and also patients who present with type 2 and 3 embouchures, root concavities, teeth with furcation involvement, orthodontic appliance wearers, dental appliance wearers, and also it aids in the application of dental fluoride and desensitizing agents.
The interdental tip is great for plaque biofilm removal along the gum line as well as interproximally. The interdental tip helps to stimulate gingival tissue and helps to recontour the interdental papilla after periodontal therapy.
The interdental tip, although it sounds great, is not indicated for everyone. Its use is contraindicated for those who present with healthy tissue due to the possibility of damage to the gingival tissues.
To prevent injury of the gingival while using the interdental tip, it is important to educate patients on the correct technique while using it. Injury to the gingiva can occur from incorrect technique as well as forcing it into interproximal spaces that are too small for the device. When using the interdental tip for massaging the interdental papilla or simply removing interdental plaque, the tip should be inserted into interdental spaces at a 45-degree angle while using light grasp and light pressure. After insertion, the tip should be moved in and out of the space using a slow and steady stroke. When using the interdental tip to remove plaque from the gingival margin, simply place the tip slightly under the gingival margin at a 45-degree angle, ever so slightly blanching the tissue. Move the tip in a side-to-side motion, moving distal to mesial, then mesial to distal, about 3 times for each tooth. For gingival stimulation, apply light pressure and maneuver around the gingival margin in a circular motion.
After using the interdental tip, it is important to clean it with soap and water and store it in a cool, dry place. For the convenience of patients, some tips may be dishwasher safe or disposable, and others may need periodic replacement. Since all of us see a wide variety of patients presenting with their own unique dental challenges, it is important to be aware of the variety of oral hygiene aids available.
Thank you for viewing our instructional video on the interdental tip. We hope this aids in your future patient education.